I grew up in Northeast Iowa, and I went to college at the University of Iowa, in the medical school at the University of Iowa, where I met my wife, who was a year behind me in medical school. I trained in general surgery first on the West Coast, and then plastic surgery at Harvard. And after several years of plastic surgery training at Harvard underneath Dr. Joe Murray, who won the Nobel Prize in Medicine, my wife and I decided to come back to the Midwest so we could be closer to our families. And so I set up practice here in Des Moines. And I was able to do things here in the community that had not been done before. I took care of a lot of children with cleft lips and palates, but children who were also born with more major facial and cranial deformities, a type of surgery that I trained in particular in Boston at Harvard, and was able to offer that both to children who were born with birth defects, but also adults who had major facial and cranial trauma. Took care of a lot of women who had had breast cancer. My mother had breast cancer when she was a young woman, and so this is something that I feel very strongly about. And I'm very happy when those women feel better about themselves after having gone through deforming surgery in which a breast was removed. Plastic surgery is a happy specialty. We're dealing with people who maybe were hurt in trauma and getting them back to normal, or people who had cancer operations and getting them back to normal, and people who have gone through aging processes and really want to feel better about themselves. And so the index for a successful case for me is whether the patient's happy with the results at the end. I enjoy this specialty, and the reason for that is because I like to get to know my patients. I like to see them get better. I like to see them happy afterwards. And so I look forward to you coming in and seeing me in my office.